And finally, can you update us on how the vaccination effort are taking place in Tigray region in Ethiopia with all the crises going on there? Thank you.
And for the second part of the question, we go to Dr. Ryan, please.
Thanks, Simon. Yeah, the situation in Tigray, in Ethiopia, remains of grave concern. There's been disrupted access to water, to sanitation, to food, to safe shelter, and to essential health services, including commodities and drugs that are life-saving. There's also been disruption of the COVID-19 intervention. WHO has worked to provide essential supplies to cover 450,000 people. That's less than 10% of the population for 3 months. But several health services, including maternal and child health services, have been very, very disrupted, and drug supplies remain critically low. The Ministry of Health is working with health cluster partners to try and make that situation better. But many are also living in overcrowded conditions in displacement camps, with the greatest risks of diarrheal disease and other diseases, including sexual and gender-based violence. The overall risks of diarrheal disease, malaria, and other important infectious diseases will continue to rise as the population remains in these circumstances. Our primary aim as an organisation, wherever we work, is to ensure that all people have access to the basic, essential human right of access to basic health care. And within this situation in Ethiopia, in Tigray, whether it be in Yemen, whether it be in Syria, whether it be in Libya, Somalia, South Sudan, our primary concern is to ensure that human beings, Ethiopians who live in Tigray, are given that basic access. We will work with the Ministry of Health, we will work with health cluster partners, and anybody else who can help us to provide better access to the population there. So from our perspective, we are very concerned. A number of the factors, particularly the malnutrition status, that people already had issues with malnutrition before, and particularly water and sanitation. This is a recipe for epidemics. It's a recipe for malaria, particularly in malnourished children. The risk of malaria and malnutrition, and those of you who've worked in situations like that know what terrible and awful bedfellows malnutrition and malaria are. So there are significant, growing and extending risks to the health of people in the region, and we will continue, as I said, to work with our partners in the NGOs in the health cluster. We currently have staff based in Mekelle, and we are completing a full survey of all the health facilities that we have access to in order to assess the absolute functionality of those centres. But safe to say is the majority of health services in the region are disrupted and not capable of delivering the essential health care package that is currently life-saving.
Thank you all very much.